Maybe explain procedure.
Yes.
Yeah.
What else?
Allergies?
Assess lungs. Auscultate. See if the patient has a pulse ox on, what they're saturating.
That would be on the finger.
How much
right?
time do I have to do all this? Is the patient in distress? You need to move quicker.
Okay.
Okay. So what I'd like you to do is I want you to suction the patient's mouth. You can suction the patient's upper airway without sterile gloves. So first put that down. Grab your Yankar. That's a Yankar. Attach it to your suction.
You know
That
what
noisy
looks
thing
like?
that's under his pillow.
That should look like a thing from the dentist's office.
Oh, you don't need that. So you take that off. I think you're going to get for your catheter.
It's like the little.
Now you can just go ahead and suction his mouth. Say, now I'm going to suction his oral cavity. He has some secretions I can see.
Okay.
I'm going to suction his oral cavity to be a
Okay, very good. All right, now you can take the Yankar off.
Like a visual.
Put it on your table, the far side of your table. Put the, no, you can put that back on, yeah. Put that back on because I think you're going to need it. Wrap it like I had it under the pillow. Or just like, so it's secured so it doesn't fall on the floor. All right, so now you're going to need to suction a patient, which is a sterile procedure going into his lower airway. You're going to open up your bottle, take the cap off your bottle. So keep the cap off and keep that on your table.
I keep the cap on?
Off. And that on your table. Okay, so now open up your sterile field. Now you're working by yourself, so I'll teach you a new technique. Okay, open up your little kit thing.
For cleaning and changing the thing, it's not section.
No. Oh,
It has
Is that
windows.
there?
I don't know.
open this
This one?
all the way.
This?
Yeah. Pull that out from there.
Where-
Now, when you're, guys, listen, important, listen, pay attention. What I want you to do is, you can take this out.
That's
That's
the-
right, that's the bottom side. I can touch the bottom side of that,
Right.
right?
Mm-hmm.
Open. I'm on the bottom side. Turn it up.
Mm-hmm.
Right. You can pour.
You can pour this in there now.
Okay. May I practice that a moment?
This is going towards, when you open it, that's going to be the bottom side going towards the table. So you can lift this up.
Yeah.
Just, I would grab the sides of it. That way, if you don't know which is top, which is bottom, just grab the side.
Yeah.
And go ahead and pour right away. It doesn't matter, it'll open up as you pour, hopefully. Okay, so now open up your sterile field. Good.
Not yet.
Oh, sorry.
Well, she would have like regular gloves on right now.
No, she doesn't have to have gloves on right now.
No?
No?
Well, she just got done suctioning there, so I would take off my gloves, wash my hands.
Okay.
So say I'm taking my gloves off, wash my hands.
And now
And
I'm
then-
looking for the
Yes.
sterile
okay.
one.
Now you need to put on your sterile gloves. Okay, so now you want to go ahead and grab your catheter. You can touch anything in there now because you're sterile.
That's true.
You can use both hands. Don't let that catheter flip and fly in the wind.
Mm.
I can still leave this here because it's sterile.
Sterile.
Okay.
Now normally what I do is in my right hand, I have my catheter kind of like holding it like this, that end. I'm inserting with my right because I'm right-handed. And then I'd go and I would go to the patient, attach my my suction to my red.
Okay, so now I have to do
Now one head gonna be dirty, right?
this,
Hmm?
because now this
Now
one's going
one
to become
head
dirty.
gonna be
Yes.
dirty.
Yeah.
What's the problem? Remember that end had to come off?
Yeah, so this doesn't, no it doesn't.
No.
Okay, this
So after you get done with your Yankar, you need to take your Yankar and you need to take your connector off.
Let me take that off.
Okay.
No, we didn't need it for that
Oh,
thing
so we
either.
don't need it for
So we don't need a period,
Oh, okay.
We don't need the
just so we don't get like any more
So we don't need it for that.
speed bumps.
Okay. Your dirty hand is your dirty hand? Okay, so now you wanna go ahead and suction your patient.
Do I suction in here first?
No, that's actually just clearing the line out. The purpose of this is to clear out the line between suctioning the patient. Depending on what's happening to your patient, if your patient is, remember I said you would not ambu bag the patient if there's mucus because you're pushing the mucus back down, so you really have to assess your patient. If it's best to give them oxygen, depending on how they're saturating, or just clearing their airway. A lot of times it's best to clear their airway first and then give them oxygen later.
For the exam, will we have to mention the oxygen part? Like, I mean,
I will assess my patient.
okay.
And Alright, now I'm
how far do we?
You go down until the patient coughs or you hit resistance.
okay. And then I start to suction as I go out.
Right? One quick mode. Do it again. Go in. I'm not sure how far does it go in on
Let me try.
The mannequins. So you feel resistance, I guess, right?
Like right there?
Okay, so that's like what, about 7 inches maybe? Okay, so now you put your thumb on and right out. Oh, that isn't very long. Okay. Alright, that's good. That's good. Now go ahead and say I'm gonna clear my line. So go ahead and
I'm
try
gonna
to
clear my
your
line.
Okay, now the line's clear and go ahead and suction again. Clean hand, dirty hand.
So 15 seconds, right? Or more than that?
That you're down.
Mm-hmm.
Not more than 15 seconds. Suction on the way out, smooth. Go ahead and clear your line. Okay, very good. Who wants to suction next? You're done. That's it. So you would go ahead and turn off your suction. Okay, then what do you need to do? You need to put the side rails up
And lower the bed.
and lower the patient's bed.
Put it back.
And then what are you going to document? I'm going to reassess my patient's lungs. Respiratory rate is 18, even unlabored. Suction, copious amounts of beige mucus, saturating 98% on the pulse ox.
You can't get
No
an
respiratory
actual
distress.
measurement of what you suction because of the saline, right?
Copious, thick, thin, yellow colored, green colored, thin. Patients in CHF may have a lot of liquid secretions, and after suction them you want to see if there's an order for some Lasix or call the doctor because fluid is backing up into the lungs. Okay, who wants to try next suctioning?
Sarah?
I'll try.